Can you hear me? But can you hear me? Can you hear me?
You're saying? Dr. Kevi, people here.
Excellent. I can hear you now, but can you hear me? Can you hear me just now?
We can hear you. We can hear you.
All right. Okay. Would you like me to start? Sorry?
You can start.
All right. Thank you. Thank you very much. And indeed, it's an honor to address you today. I'm here in Arusha as we discuss a sectoral council meeting on the on the Finance, Trade and Investment Council of the East African Community. Now, ladies and gentlemen, indeed, I'm honored to be part of the perspectives with respect to opportunities and challenges and best practices for the health sector today at the Strathmore University Auditorium. And indeed, I congratulate all of you for this opportunity of dialogue, insight, and ideas, primarily because we are entering a very exciting phase within the context of His Excellency President Kenyatta's chairmanship within the E.A.C. and what it has achieved to date. And this includes efforts we've put in place by way of the review of the Common Market Protocol. Why I'm sharing this background information is that it's one of the most definite issues by way of what you are thinking with respect to the scale and issues of quality and relevance with respect to the healthcare sector, and in particular access. And by way of what I'm sharing, it is part of that ecosystem. And so while it's broad-based, it'll help you, I'm presuming, build the necessary confidence and direction to make much larger decisions. Now, within the context of the common market, we see that it first was established in 2009 and came into force in 2010. Of course, much has been achieved by way of freedom of movement of goods, people, workers, services, capital, as well as the rights of establishment within the East African partner states, the 6 partner states consisting of 170 million, including the rights of residents, all of which is absolutely critical for an ecosystem for health services, as we know. Much has been achieved by way of the protocol, but is currently under review with respect to the modernization. And why I share that is it gives the health sector a chance to develop the with respect to a public-private partnership as far as healthcare is concerned. Now, the achievements to date have been the fact that, the GDP of 160 million people is approximately 170 billion. We've seen various systems in place that have addressed external shocks. We've seen rapid transaction across border posts, of one-stop border posts, inclusive of healthcare, and various border points being opened up in order to promote the necessary migration of 160 million people. We've seen harmonization of education standards, and in particular healthcare standards and service standards pertaining to qualifications of people. And efforts are being put in place to go all the way down to artisan, craftsman, master craftsman, and technician level. We've seen the important role of currencies and the convertibility, but most importantly, you've seen that budget statements are read out at the same time, and efforts are put in place. What's also very interesting is that a recent report since 2010, and a recent survey conducted shows that migration has doubled within the East African community, the 6 partner states. And this now is at a record high of approximately 5 million people. What's also very interesting is that it's women who migrate more than men, and this just goes to show that their interest in intra-trade is significant by way of achieving the standards of integration that are possible. We do have challenges from an economic perspective, and indeed mechanisms are in place with respect to issues of NTBs, and in particular the challenges we've faced with respect to COVID-19. Within the context of His Excellency President Kenyatta's chairmanship, much has been achieved, ensuring that the E.A.C is indeed a vehicle with respect to achieving the prosperity of different sectors, including a One Health solution. And within this context, what is also extremely relevant to this discussion today is that we have just concluded a 4-band structure with respect to the common external tariffs, ensuring that we're able to promote 0% for raw materials, 10% for intermediate goods, 25% for finished products, and an additional 35% for finished products too. This has major implications by way of the kind of industries and setups that the healthcare fraternity provide within the context of the E.A.C. What's also remarkable and of great importance is the fact that we've been able to keep our borders open, building consensus by way of all the protocols and standards required by WHO to achieve our success. We've witnessed bilateral frameworks between partner states, encouraged by the fact that His Excellency President Kenyatta has made several visits, but also invited various heads of states to Kenya. NTBs have been greatly resolved, and we're moving into a new phase of phytosanitary protocols and standard setting within the context of the East African community. What's also very significant from a political, economic, and social perspective is that not only have we hosted presidents and resolved NTBs, but we've gone ahead and set economic systems around opportunities with respect to facilitating trade, thereby creating intermodal transport systems which are absolutely necessary on one hand from an economic perspective, but also necessary from a social perspective as far as health is concerned. And this includes inland container depots as well as the upgrade of Lamu Port, Mombasa Port, and so on. Various critical border posts have been established with health agencies intact within the ability to promote not only aspects of COVID-19 response, but also innovating by way of creating One Health Pass, a electronic recognition system for certificates with respect to the credence of COVID testing and so on. And what's significant here too is that recently, of great importance to this discussion today, is the fact that the seventh partner state will be joining us upon acceding their instruments to the summit in a month's time, and that will be DRC Congo. Now, this would greatly change the trajectory of healthcare within the context of E.A.C, because we're looking at now not 170 million, but 300 million people in totality, making this the fourth largest population by way of a federation. This would be after India, China, the United States would come the East African community. This fully integrated system is not merely just a trade bloc, but it covers the span of social, economic, political systems by way of the four pillars: the customs union, the common market, the monetary union, and the political federation. And for the healthcare sector, it creates not only the physical routes that cut across the Indian Ocean, from the Indian Ocean to the Atlantic Ocean, but cut to the very arteries of the East African community and the continent. Within this context, efforts have been put in place too by way of the E.A.C creating links to various partner states and blocs abroad, including the European Union, CN, and so on, the American bloc, all with a view of seeing how we're able to integrate the economy as a key driver towards a people-centered approach. Within all of this, ladies and gentlemen, the E.A.C health sector is one of the most profound platforms and is one of the greatest enablers towards integration from all perspectives. And while major challenges of various communicable and non-communicable diseases affect a good segment of this population, with diseases with respect to epidemic ranging from malaria, AIDS, and tuberculosis, quality essential medicine as well as the efforts of various structures have been put in place. And this includes starting with the treaty and how it's important for partner states to take joint action towards prevention of non-communicable diseases, as well as pandemics and epidemics and vector-borne diseases. There's also been efforts towards creating a safe and efficacious, quality and affordable essential medicine and health technologies within the E.A.C population. While this remains a major challenge, it remains an opportunity too. And within this context, as far as initiatives in the health sector are concerned, as far as policy development is concerned, we see that a regional strategy on prevention and control of non-communicable diseases has been established, and this provides guidelines as well as plans and preventions of control of NCDs. An E.A.C health policy has been established promoting a common approach in the prevention and control of diseases. Further to that, a pharmaceutical industry within the E.A.C region has been envisioned with respect to development of medicines and policies, legislations and regulations to guide this sector. This is closely hinged to the industrial policy and strategy, which creates an enabling environment to promote diversification of healthcare, but healthcare being one of our key value chains within the context of the E.A.C. in view of the value proposition of approximately 300 million people. Further to that, the East African Community Regional Pharmaceutical Manufacturing Plan of Action has been established, 2012, 2016 and 27, promoting that efficiency, productivity, innovation in pharmaceutical manufacturing industries. A blueprint within the context has been established with respect to government commitments which ensure that imports from 70% to less than 50% would be supported, and this would enable the expansion of that entire sector, ensuring that we have more advanced formulations for release with respect to vaccines and other kinds of medicine. An E.A.C. regional good manufacturing practice has been established in order to cater for a more holistic pharmaceutical manufacturing industry, and various efforts have been put in place by way of harmonization of E.A.C. medicines and technologies, thereby setting standards of common harmonization throughout the E.A.C., thereby ensuring the delivery and the driving force of technology as a healthcare provider, but at the same time ensuring that we're able to create a holistic system. And there too, an E.A.C. medicines and health technology has been developed, focusing on health technologies and pioneering local content as well as capacities. Further to that, the E.A.C. medicines regulatory harmonization systems have been strengthened as far as institutions and harmonization within partner states with respect to decreasing registration time and reducing duplicative efforts. Further cooperation framework agreements for the E.A.C. partner states on national medicines and regulatory authorities have been put in place, looking into all aspects of product evaluation, good manufacturing practices, good clinical practices, medical health and technologies, pharmacovigilance, areas of regulation, QMS, an integrated information system, and so on. In order to build more capacity in East African community and medicines and health technology, strategic plan has been rolled out, promoting universal access, as well as the review of common external tariffs for the pharmaceutical industry, thereby ensuring that a certain level of nurturing and protection is created to usher in an industrialization in the healthcare capacities. The E.A.C. Regional Contingency Plan for Epidemics due to communicable diseases on One Health approach has been established, and reference laboratories for communicable diseases and their standard systems and their training systems have been harmonized. This One Health platform has significantly been one of our key priorities under His Excellency President Kenyatta's chairmanship, in view of the fact that we need to synergize scale efforts of quality, access, and equity in healthcare. Inspections of medical and dental schools and teaching hospitals have also been established within the context of setting standards, and several centers of excellence have been established with respect to urology, nephrology, the Kidney Institute within partner states, promoting that specialization within the context of the 6 partner states and Congo is about to join. Further capacities as far as innovation and research are being choreographed by the East African Health and Scientific Effort and Conference, and has become a training ground as well as a sensitizing ground and a collaborative ground to bring about the innovations in healthcare. Within the context of Digital Regional East Africa Community Health Initiative, not only have we created a one network for ICTs within the E.A.C., but we've also created the e-commerce strategy and various other enabling structures together with the Common Market Protocol, which enables the Digital Regional East African Community Health Initiative. And this is a digital reach initiative whose mission is to maximize the power of digital health in East Africa, bringing the capacities of quality health and people-centered approach. Partner states have sought the help of digital health to reduce cost sharing as well as access and equity and standardization of digital health training. And this indeed have shown further achievements within the context of digital health, the promotion of advancement of technology, stronger evidence by way of data collection, the creation of opportunity, introduction of economies, the negotiating power of service providers, and all manners of other key surveillance capabilities, as well as positioning within the context of using digital as a key enabler. Ladies and gentlemen, with respect to the challenges, one of the key areas that we do need to work towards is good nutritional standards, promoting that harmonization and building that capacity within the E.A.C. Kenya has achieved the process of establishing a Food and Drugs Authority, but the need to harmonize within the E.A.C. is critical. The ability to make progress towards taking joint action in promoting some communicable diseases is also critical, and the efforts towards devolving and cascading E.A.C. projects and health strategies to grassroots levels is also a challenge, which is an opportunity for innovation. Further challenges include the health sector projects, the fact that we're dependent on donor funding, and the need, to see how we're able to promote a more public-private partnership. And within this context, the E.A.C. has rolled out the public-private partnership scheme, now promoting that capacity for many different stakeholders to provide a collaborative effort and joint responsibility. And this, we believe, will address the over-reliance of donor funding. As I close, I think that indeed it is a time for reflection and time for action within the context of a much larger progress of 300 million people. And indeed, this indeed should be the value proposition to act together. I am in full confidence that our health fraternity within the E.A.C. has the full potential, if synergized together and scaled, to not only make an impact for the E.A.C., but be a key hub for the entire continent within this context. And I think that I wish you much ambition and brave thinking in view of the fact that governments have worked closely together, but a pivotal role has been achieved within the context of Kenya's chairmanship, which really lays the actual platform and framework for a highly expanded world standard in healthcare. I appreciate very much, and I thank you, and I wish you much success and deliberation today.
For dialing in. I hope you can hear me. All right, I see the smile. Evening, wherever you are. Thank you. A better round of applause, ladies and gentlemen. So at this particular point, I'd like to welcome the next part of the presentation from Penda Health. I'll call upon Dr. Sarah Kitines to give us his presentation, which will open up to the plenary session. Thank you.
Good afternoon, ladies and gentlemen. Good afternoon. My name is Dr. Sarah Kitines.